The World Health Organization says at least 17 million people in the EU may have experienced long COVID symptoms during the first 2 years of the pandemic. It finds that women were more likely than men to suffer from the condition. The study for the WHO by the Institute for Health Metrics and Evaluation tracked roughly with other emerging research. Meanwhile, Ontario's recently disbanded Science Table reported that the province needs a comprehensive strategy to deal with long COVID. The team of scientists are calling for substantial investment in research and healthcare resources. They say this is needed to mitigate the long-term health, social, and economic impacts of long COVID. Well, joining us now to talk more on this in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Thanks for having me, Nima.
So, how many people in Canada are affected by long COVID, Dr. Raut?
That is a very good question. So we know that early on in the pandemic, the WHO estimated that roughly 10 to 20% of COVID patients would get long COVID symptoms. The Public Health Agency of Canada states it can be somewhere between 30 and 40% of those not hospitalized. And that in itself is a big difference. But now with more consensus coming in, the suspicion is that there is a huge range here, somewhere between 2% and 54%, depending on how you define the condition. Now, the science table you mentioned defines it as symptoms ranging for 4 to 12 weeks after a COVID-19 infection. So if we take that as the standard for measurement, we're probably looking at 2 to 10% of all Canadians who had COVID-19 experiencing long COVID symptoms.
Now, what really stood out to me in this report was that women were more likely than men to have long COVID symptoms. Why was that?
Yeah, that's right. So what we saw was that women were more likely to experience this long COVID condition. We saw that women presented with a variety of symptoms, specifically ear, nose, throat symptoms, mood disorders, neurological, skin, gastrointestinal, and even rheumatologic and fatigue symptoms. In contrast, men tend to experience more endocrinology disorders like diabetes and kidney disease. Now, we don't know exactly why that's the case, but what we do know is that women tend to mount a more robust and rapid immune response, which will probably help fight the initial infection. But then when we look at these long COVID measures or long infection measures, you're more likely to have those, unfortunately, there.
So, what kind of impact could long COVID have on our already overburdened healthcare system, Dr. Raut?
All right. So long COVID, we know it's a very serious problem with a lot of consequences here. Amongst my own patients and everywhere, we're hearing stories of many people in financial crisis and facing relationship problems, losing their jobs, and falling into depression. Not to mention the healthcare workers themselves who were on the front lines are now experiencing these chronic symptoms as well. So I think what we're seeing is that these long COVID consequences are going to be very severe, and we do need to act on them as soon as possible.
In terms of acting on them, we know Ontario's Science Table is calling for a strategy to deal with long COVID. So, what kind of steps should our officials take to address this condition?
Right. So what we know, the big parts of long COVID are fatigue, memory deficits, shortness of breath, sleep problems, and joint pains. So what officials should really do is have a very targeted approach to those five things. We need teams of healthcare workers focused on long COVID symptoms. And really the best way to do this is to fund specialized long COVID clinics, where you have a group of healthcare workers who can really make a difference and provide relief for these patients who are suffering with these symptoms.
All right, Dr. Raut. Well, over the last 2 years, there's been a lot of ongoing research into the effects of long COVID. So I know you mentioned some symptoms, but did we learn anything new about this condition over the last 2 years?
Right. So I think what we've learned is that a lot of these symptoms are caused by the angiotensin converting enzyme 2, which COVID-19 makes changes to that enzyme to upregulate it. So those changes then cause systemic changes to the body. Damage to the brain causes the brain fog and fatigue. Damage to the heart and lungs cause chest pain, shortness of breath, and palpitations. And damages to the kidney and liver and pancreas causes these dysregulations in our ability to fill out toxins from our bodies. And finally, the damages to the GI tract are these long-term diarrhea, nausea, and throat issues. So there's a lot of individual research into each of these injuries to look at how we can mitigate them and even prevent them in future cases.
A lot of research, but still a lot to be done. Dr. Raut, thank you again for joining us today on Forum Daily.
Great. Thanks for having me.